Thanks very much for that wonderful introduction. Who here has heard of a physiatrist? Not bad. Not bad, actually. That's pretty good. Okay, so it's exactly what Annette had mentioned. That's right. So we're doctors that look at physical impairments, and it could be from many different disease sites. And often the populations we work with are often people with brain injuries or amputations or musculoskeletal injuries, and we try to help with those impairments and try to, whether it's a pain issue or helping them move better again or help them function better again at home, it's really about how to recover from that in the best way possible. So when you look at the evolution of person-centered cancer care, really there used to be this duality, right? There's sort of how do we treat the tumor and how does that help with overall survival? How do we shrink it? And then later on came this idea of supportive care, and I think Dr. Hales did a wonderful job of sort of discussing like a lot of the psychosocial needs and supports that can be done for patients. The concept of rehab in cancer, it's something that's older, like in the 1970s it was developed, but it's really taken off more in, I would say, the past decade or so. So fellowships like the one I did at MD Anderson really are only about 10 years old. So again, what is cancer rehab? It's really a specialty that aims to allow for achievement of optimal physical, social, physiological, and vocational functioning within the limits imposed by the disease and its treatment. Putting it much more simply, we're trying to improve function through physical strategies to manage impairments caused by cancer and cancer treatment. And again, not that much different from other types of injuries that people might suffer from, such as a broken hip, where there's an injury that needs to be fixed, and then you do things to try to improve that functionality of that joint or limb or body part. In rehab, we have usually an interdisciplinary approach. Where I work at Princess Margaret, we are part of something called the Cancer Rehab and Survivorship team, and our team members are really in this sort of circle of people. So as you can see, the medical piece is just sort of one part of how we try to help people with their different impairments. But most of you probably know what physiotherapists do, right? They help with mobility and strength rebuilding. I think from a rehab standpoint, a lot of us know about that, but the other areas we see less, you might see less of, like an occupational therapist who's really looking at the functional skills that you're doing at home, like how are you actually getting dressed, or how are you actually doing laundry, or how are you actually making a meal at home when you're dealing with a certain physical problem. Kinesiologists are people that are more specialized in exercise medicine and really help to develop exercise prescriptions. Massage therapists might help with lymphedema management as well as scar adhesion after your surgery. People that help from more of the psychosocial aspect are obviously really important as well from a rehab standpoint, and nutritional needs become important when it comes to physical building or rebuilding, I should say. So some of the common impairments that I see in melanoma, if you were to sort of categorize into generalized versus focal problems, really generalized, fatigue is definitely the main impairment that I see. Deconditioning is more of like that, just, you may have become a bit more sedentary or just less physically active as a result of your treatment, and just weaker as a result of that. Brain fog is as a described adverse effect from some of the treatments of melanoma, as well as, if you were to actually have a brain metastasis or radiation to the brain. Focal treatments, like if the melanoma is just in like a certain spot of the body, it can certainly cause pain in that area of the body. I think lymphedema was alluded to earlier. We're going to talk a little bit more about that. And then again, based on where the melanoma is, if it's sort of, especially if it's part in one of your limbs, it really can cause significant decrease in the movement and strength or sensation of that limb. If it's hitting on a nerve, it might cause a lot of pain or sensory disturbance of that particular limb. To go on a little bit, so I'm going to talk a little bit more about fatigue and lymphedema specifically. Fatigue is described as the most common and debilitating symptom overall experienced by patients with cancer in general, and this would include the melanoma group. We know that the different immunotherapies, as discussed by Dr. Butler already, can cause significant amounts of fatigue. The monoclonal antibodies, you sort of see a general sort of 35 to 50% range there. Obviously, those are not all the severe, and I think sort of a 10 to 20% number was given by Dr. Butler just now. The interferon certainly can cause a high level of fatigue in many of our patients, and if you had to have radiation to one of your limbs, like your lymph nodes after your treatment, we know that fatigue is certainly a part of that treatment. Now, although we know that melanoma itself can create some fatigue by just a bit of an minor inflammatory response in the body, Dr. Butler already mentioned the idea of immunotherapy and other medications creating fatigue. But fatigue is a symptom that is it's sort of like a final symptom of many different problems and conditions. So, even if your melanoma is under really good control, or even if your immunotherapy isn't causing that much fatigue, I mean, other aspects of how you're coping and how you're dealing with your cancer can certainly contribute to fatigue. For example, poor sleep as a result of just sometimes the worries of what's happening, or if you have been on a steroid or dexamethasone to try to increase that energy, can sometimes sort of do the reverse and reduce your sleep. Poor nutrition, poor hydration, we know that can affect your overall energy levels and ability to sort of try to physically activate yourself. Dr. Hales did a really good job of just talking about mood disturbance, and we know that depression and anxiety certainly can cause fatigue as a sort of a secondary symptom. We talked about the decrease in physical activity level that we often undergo when we are undergoing treatment or when we're dealing with our disease. It's sort of a commonly used strategy to just sort of take it down a notch. And then pain can certainly cause fatigue. Other medical conditions that you have on top of your melanoma and treatment can contribute to your fatigue. So just say you have some anemia, or you have some breathing problems from obstructive pulmonary disease. These are things that just don't help you when you're trying to deal with all these layers that are kind of pushing you down a little bit when it comes to that lack of energy. So Dr. Hales also alluded to the fact that most cancer patients do not like medications to treat their their disease, and it's this sort of often that sort of feeling of just the toxicity that they've experienced as a result of their treatments. So really, again, when we look at the physical strategies, we're not saying that these things are going to eliminate the fatigue, but maybe we can help manage the fatigue a little bit better by just some professional help or just some common sense things that you can do. Obviously, if your sleep is off, then trying to restore your sleep, whether, again, it's through just what we call sleep hygiene, going to bed at a regular time, trying to do a bit of exercise right before bed, try not to drink that big drink of water right before bed, might just help you have some better hours of sleep. Hydrating yourself again, drinking, eating, trying to create that balanced diet. Sometimes it's just calories. If you're not eating at all, just getting the calories in there becomes really important. Pain management. We know that if you're in pain and just sort of suffering through that pain, it's really hard to feel energy. So again, sometimes that pain management does come through the use of medications to try to really help reduce the pain so that we can improve that energy level. We sometimes talk about the 3 Ps when we talk about fatigue management. Pacing is just the idea of not going from 0 to 100 and trying to sort of do all the things that you were doing before. We know that these treatments and the disease can cause fatigue. So the idea of trying to pace what you're doing during the day and use your energy efficiently becomes a really important strategy. Prioritizing, if you have a couple of really important things that you need to do and a couple of things that are less important, it's okay to focus on those priorities and try to spread out your week a little bit more. Planning ahead is also helpful. When we talk about fatigue, there's sort of that physical fatigue that we have, that sort of overall energy and that ability to move and shake. But really, there's cognitive fatigue as well, right? Like Dr. Hales talked about, like, going home to help her patients, or her kids go to the, like patients sometimes, but help her kids go to bed, and it's just like that. Your responsibilities as a family member, as a friend, as just if you're still working, this is really tiring on your body, and just trying to create a schedule ahead of time sometimes can allow a bit better use of that energy the next day. Obviously, like, life happens, things are going to pop up on you, and you can't plan for everything. But I think sometimes just that sort of, managing your expectations of what you can do in a day might just help you manage it a little bit better. So I had a question mark beside exercise. So, like, is exercise good or bad? Like, is exercising too much going to actually fatigue you more, right? That would be a common sort of conception. And yes, absolutely. If you over exercise, for sure, you can get so tired that you can't do anything the next day. It's really finding that balance. We know that Canadian Cancer Society and across the country, exercise is recommended after your melanoma diagnosis. And in fact, it's recommended after any cancer diagnosis. Basically, Cancer Care Ontario came up with some specific recommendations based on multiple systemic reviews on which included melanoma patients on what we should be prescribing from an exercise standpoint. So it's first important to understand that exercise is safe to do during and after treatment. It is effective at reducing fatigue, at least moderately, and it can also obviously improve your physical fitness. They generally say, like, make sure that your doctor just has clarity. Like, make sure that you don't have a new heart condition or a new lung problem that might make it really challenging to exercise or make it dangerous to exercise. I would say 99 times out of 100, this is not the case in our general cancer patients. And then sort of what the recommendation they give here is give a moderate intensity of exercise. Try to aim for 150 minutes per week. And again, if you're doing 0 or 5 or 10 minutes currently, don't go to 150 minutes right away, or it's going to exhaust you. But a moderate intensity is usually if you're doing a really brisk walk, and you can sort of talk and walk at the same time, but you're sort of breathing through that a little bit. Obviously, if you're a higher level athlete, you can do a little bit more than that. We usually recommend trying to do at least 10 minutes at a time if you're going to do it, to kind of get those cardiovascular benefits from the exercise. So even if you did 10 minutes twice a day for a week, that would actually be 140 minutes, right? So it's not that hard to conceptualize, maybe introducing a little bit of exercise. We do know that even a little bit, even if you're not able to get to 150 minutes per week, even if you're going 30 to 60 minutes per week, it's still beneficial for you. This is more of something to potentially aim for. There are exercise programs in supervised settings and group settings, and I sort of gave a little bit of a spectrum of what we have in Ontario. So there are, if you have a personal trainer or have access to a kinesiologist, sometimes you can just be given a home exercise program, and you have exercise equipment at home or in your apartment gym, or you just need very basic things in order to just initiate a light exercise program at home. But usually it's helpful to get a bit of professional advice around that. I think Dr. Hales mentioned some of the community-based supports. So we do know that Wellspring and Gildas Club do support exercise programs, and some of them are very light and some of them are a little bit more intense, but certainly helpful ways of engaging, and these are not at a cost to the patient. McMaster has teamed up with YMCA as well, closer to Hamilton, where they have again access to kinesiology, an exercise program, and physiotherapy. Waterloo has a small fee-based exercise program where basically run by kinesiologists. And I believe it's about, I want to say a 10-week program. In the hospitals, if you've had cardiac complications or something along those lines, you would be eligible for a cardiac rehab program through a hospital. And then at Princess Margaret, if some of you are Princess Margaret patients, our foundation has given for what we have, which is a sort of an 8-week group exercise program, as well as access to kinesiologists for a home-based exercise program. So it is important to know that rehab in cancer is a very poorly funded area through government, and I think that if you look at what is actually available, it's usually through philanthropy that a lot of this has happened. It would be nice if if everyone could access this clearly. Lymphedema is the other impairment I really wanted to just touch on as well. So basically what lymphedema is when you accumulate fluid, and usually it's in one of your limbs after your lymph nodes have been taken out or been radiated, or both. The lymph system is a part of our circulatory system, so although most of us know about our veins, right, those blue things that sort of help deliver blood back to our heart, our lymph system helps deliver sort of that fluid that's in our soft tissues, larger proteins, some of our immune cells back to the heart through sort of a separate system. I have a picture. In anatomy models, they look green, but our lymph system is actually like a pale yellow color, and essentially these lymph vessels sort of go towards these lymph node systems, which are hubs of immune cells that allow us to fight infections and again also to just deliver fluid and protein back into our blood system. The mainstay of management for lymphedema is what we call complete decongestive therapy. It really means that we want to keep our limbs well moisturized and try to sort of avoid cracks and infections in our hands and our arms, or sorry, if it's your arm that's affected. The compression garments or bandaging. So if you have lymphedema, probably if you were just to get one of these things, the most evidence is around compression strategies for trying to push the fluid back up into your circulatory system. And usually when lymphedema is new and sort of really puffy, we actually recommend compression bandaging. So this isn't like tensor bandaging, okay? This is more something called a short stretch bandage. Usually what we use is Comperlan. And there are specific ways to learn how to bandage the arm in order to shrink the limb before you actually develop, you purchase sort of a sleeve or a glove or a stocking to help manage the lymphedema. There's a special massage technique known as manual lymphatic drainage that helps you try to, again, encourage the lymph to go towards the heart again. Exercise strategies. We know that using your muscle pumps, the lymph vessels are one-way vessels. So basically, when you pump fluid through, it shouldn't back up again. So actually, doing a bit of exercise can be helpful for that. Deep breathing also helps create a negative pressure in your thorax and allows you to encourage that fluid back into your circulatory system. In summary, cancer rehab really considers the physical strategies for cancer symptom management and that sort of recovery. Sometimes we're trying to restore you back to where you were. Sometimes we can't quite get you where you were. We need to learn how to deal with that and compensate for those problems, and that's what really cancer rehab is all about. Thank you very much.